So blood donation is doing good for others, right? Well, yes, usually, but what about donating for your own health? Is it a smart move or a dangerous mistake? The answer is not so simple, and really it depends. My name is Dr. Taranella, and I help patients optimize and navigate complex health issues every day. Today, we're cutting through the confusion around iron, and we'll reveal when blood donation actually helps, when it can actually harm, and help you understand the 3 critical iron types you must know and the non-negotiable labs to track for your safety. Okay, so many of you have expressed some concern and confusion around when to donate blood and when you're possibly overdoing it with the blood donations. And this is the single biggest danger zone, is donating when your red blood cell count looks okay, maybe even on the high side, but your actual iron storage tank, i.e. your ferritin, is on empty or very low. And why is this critical, or why is this important? Well, oftentimes donation centers typically only screen for anemia via low hemoglobin, and they don't check your iron reserves. And so you could pass their general screening, but be depleting the already somewhat low iron stores. And this could lead to things like fatigue, weakness, and just feeling kind of awful. And so in my opinion, checking the ferritin is a non-negotiable before donating blood therapeutically. Making this decision safely requires knowing the right questions and labs to do. And that's why I made a high iron hemochromatosis playlist. It tackles the key questions and points to navigate these situations. So I'll put a link to it in the description. So to truly understand this harm versus help, we need to know and understand your body's 3 different iron pools. The first one we can think of as like the iron highway. This is the iron actively traveling through your blood, ready to be used. We can measure it by things like serum iron, and this is the concentration of iron in your blood right now. This is going to fluctuate a little bit with meals. There's also the total iron binding capacity. This is basically, you can think of as the transport vehicles or iron trucks that are available. The iron trucks are like the transferrin that carries the iron around. And then the transferrin saturation is how full those trucks actually are. A high percentage of transferrin, like over 45 or 50%, is often the earliest sign of potential iron overload or hemochromatosis. So you can think of this as the immediate iron supply, but it doesn't give us the full picture. Second, we have the actively working iron. And this is the iron that's locked inside your red blood cell, carrying oxygen in the form of hemoglobin. And hemoglobin is the oxygen-carrying protein, and low hemoglobin is typically associated with anemia. In fact, that is diagnostic for anemia, either low red blood cells or low hemoglobin. And this is what the donation centers are typically measuring, is your hemoglobin. And then we also have the hematocrit, which is the percentage of red blood cell volume, or how much space those red blood cells are taking up. And part of that is the number of red blood cells, but also includes the size of the red blood cells. High hematocrit can mean that you have some kind of polycythemia, either primary or secondary, and this is also referred to as thick blood. So this is crucial for making sure you have enough oxygen carrying capacity, and also to make sure your blood viscosity is not pushed on one side or the other too far, meaning you don't have enough red blood cells or you have too much red blood cells. But it tells you nothing really about your iron reserves. And that's where the third iron pool comes in, and this is key. This is basically like your iron vault, your stored iron. And we can think of this as dictating your margin of safety. And it's measured by your ferritin levels. Ferritin is a protein that stores iron, and so it reflects your total body iron storage reserves. In a low ferritin, less than, say, 30 to 50 nanograms per ml, definitely warrants a little more caution around donating blood. And somewhere around 20 nanograms per ml is definitely at higher risk for becoming anemic and having problems from too little iron. Ferritin can also sometimes be a trickster, because high ferritin can sometimes be falsely elevated due to inflammation. And this can happen even in the presence of anemia, meaning low hemoglobin. And so this is why a comprehensive understanding, looking at the different iron pools, is really important, and why your labs really do matter. So these 3 pools of iron aren't always in sync. Sometimes one will show elevation while the other one shows low, or vice versa. But sometimes they are all 3 in sync. But let's go through some scenarios to help you better understand what these 3 iron pools are telling you in different situations. So let's say, for instance, you have a high hematocrit but a low ferritin. This is classic for testosterone replacement therapy or TRT situations. And testosterone is basically telling your body to make more red blood cells faster. And it does this even when your iron levels are low. So it's pushing your ferritin into that other pool, that active pool of hemoglobin and red blood cells. And this is specifically worse when you're basically donating blood all the time. You're basically taking from the vault, sucking out all out of the vault, and then donating that. And so it depletes those storage or vaulted iron levels. And when those levels are low, donation in this scenario can actually be harmful. And it can induce iron deficiency, making you feel weak and fatigued. Even though you are fixing the thick blood or the polycythemia of too much red blood cells, you're creating another problem on the storage side. Scenario number 2 is normal hematocrit, but really high ferritin. This is often a scenario with hemochromatosis. This is where the vault is really full and you have no idea because the red blood cell levels look normal and haven't even been maxed out yet. They're just kind of sitting in the middle somewhere. Or it could be a situation where there's inflammation going on causing a falsely elevated high ferritin. If it's true iron overload, donation here is going to be needed eventually, depending on how high those levels are and what the total picture looks like. But if it's inflammation, donation can actually hurt or make things worse because oftentimes the active form of iron doesn't have access to the stored form, and the hemoglobin and red blood cells can start to creep down over time. You go donate blood, you might drain this a little bit, but you're really going to drain this. And again, it doesn't have access to those storage forms. And so it's key to look at more than just the hemoglobin and iron stores. You also want to be looking at things like inflammation to understand that dynamic. So when does donation actually help? When is it always going to be helpful for you? Well, basically, when you have confirmed iron overload like hemochromatosis, donation is going to be the primary treatment for this. And the goal is to lower the ferritin, lower the iron saturation to a certain range. So for instance, for your ferritin, you're going to want to be around 50 to 100 nanograms per ml to prevent organ damage. And also that range is going to bring down your iron saturation. And as that iron saturation level comes down, there's less likelihood of the iron bumping into and damaging organs and tissues as it's being transported around in your body, because that iron saturation level is going to be much lower. Initially, the frequency of donation is going to be a lot more frequent, and then it's going to be spaced out as that iron saturation and ferritin starts to go down. But we always want to make sure we have our eye on that hemoglobin, that we don't tank those levels too much too quickly. For those with symptomatic polycythemia, maybe you're having chest pain or breathing issues or sleep issues, this is often induced by testosterone replacement therapy. And one of the management strategies is to go donate blood. And the goal here is to lower the hematocrit, or the percentage of red blood cells compared to the liquid or clear fluid. When it's greater than 52 or 53%, it's said to increase the risk of blood clots. The frequency of your blood donation is going to be based on your hematocrit trends, but also what's happening with your ferritin. If your ferritin levels are too low, you can't just keep donating blood. That's going to cause other problems, and it's going to lead to you feeling a lot worse as well. Oftentimes what I'll do with my patients is lower the dose of testosterone, start some iron. Once we get adequate ferritin levels, then we'll go donate blood and bring those levels down. Sometimes just adjusting the dose of testosterone will lead to a stabilization of that hematocrit as well. So at what levels is blood donation actually contraindicated? When is it more likely to harm? Well, we kind of alluded to this before, but we definitely should not be doing any blood donations when your ferritin is frankly low. And that's when your storage tank is basically on empty. It's just have barely enough to do the minimum amount of the body needs. So we should be cautious when we're around 30 or 50, maybe even 60, we should be cautious. And when it's less than 20, I would say it's a hard pause or hard stop until we get you on some iron and we get those levels coming up. If you're already anemic, meaning low hemoglobin, low red blood cells, then there's really no reason to be doing blood donations anyways, but for sure you wouldn't want to donate blood in those scenarios. Also understanding the dynamic between inflammation and your ferritin and your hemoglobin and what's kind of driving that should also be a consideration. In that case, when your ferritin is being driven up by inflammation, the blood donation isn't necessarily going to help that. But the context greatly matters here too. So a CRP of 3 or 4 is, yes, inflammation, but it's not necessarily going to raise your ferritin all that much. So we don't just treat the labs, we're treating the actual person in front of us, and that's where understanding the history of the labs and what's going on with the person can help us make these decisions. And of course, if there's no clear indication to donate blood, you want to use more caution with how often you're going in to do that. Or at minimum, at least get a ferritin checked periodically. So really the idea here is you don't want to be guessing about this, and you can check out that free playlist on high iron and hemochromatosis to make sure you're asking the right questions about ferritin. And again, link will be in the description there. So the bottom line is donation is going to help for those diagnosed with iron overload or symptomatic polycythemia or elevated hematocrit levels in conjunction with proper monitoring of your ferritin levels. If your ferritin stores are low, even if hemoglobin and hematocrit look okay, you definitely want to be using a little bit more caution and a little bit more attention to the total pools of iron. But if your ferritin level is high, but your iron levels are actually normal, the real question you want to be asking is, why is my body storing it like that? And I'll break that down in the next video right here.